Well, good morning, everyone. I'm Dr. Jim Allen, and I'll be moderating today's COVID Health and Wellness briefing. The purpose of these briefings is to give you, the members of the media, direct access to some of the COVID-19 experts here at The Ohio State University in order to help support and enhance the statewide communication efforts with science and medical information. Let me introduce today's panel. Dr. Andrew Thomas is the Chief Clinical Officer for the OSU Wexner Medical Center, as well as the Regional Representative on Pandemic Response. Dr. Peter Moeller is the Chief Scientific Officer for the OSU Wexner Medical Center and also the Vice Dean for Research of the OSU College of Medicine. And Dr. Nora Colburn is an infectious disease specialist and the Medical Director of Clinical Epidemiology for the Ross Hart Hospital. First question I'm going to ask is to Dr. Thomas. We've been seeing a downward trend of new cases recently. Is that continuing here in Ohio?
Good morning, Jim. Thanks to all the folks in the media for being here today. Yes, it's actually quite, I think, a good news story over the last few weeks. When you look back at where we were through most of November and into December, our case rates in terms of new cases diagnosed has really been trending down over the past month. As many folks know, the governor reports this out routinely on his press conferences, and the state is looking at potentially making some changes around different requirements in terms of the curfew, in terms of both case rates as well, and what we've been focusing on in many of these media briefings before, are hospitalizations. If you think about it across the state, we peaked at over 5,000 patients in the hospital on our worst day back in mid-December across the state. We've been under 3,000 patients in the hospital with COVID over the last 9 days. Here in central Ohio and southern and southeastern Ohio in zone 2, we peaked at around 1,200 patients in the hospital back in mid-December. We've actually been under 500 patients in the hospital over the last 4 days. So I think it's a really positive trend. Once again, as we've talked about before, the citizens of the state of Ohio, and certainly the citizens here in central Ohio, I think got the message, are taking this seriously, and are doing their best to reduce the risk of transmission in our communities.
Well, how are things going with vaccinations at Ohio State?
Our vaccine program is going incredibly well. We crossed a couple of thresholds this week, which I think are quite positive. We have now, as of yesterday, delivered our 10,000th first dose to a patient in that group of elderly patients in Group 1B. We moved to the Schottenstein Center, as most folks know, back on January 15th. Opened up to elderly patients based on the state's requirement the following week. And since the week of the 18th, have delivered now over 10,000 first doses to elderly patients in Group 1B. Also, as of Monday, we've now delivered more total vaccinations at the Schottenstein Center site than the seating capacity of the arena. That's just an amazing stat. When you think about what that arena looks like on a full basketball game or a full concert, and to think that there in the concourse over the last couple of weeks, we've vaccinated, and that's total of first doses and second doses, more patients than the seating capacity of the arena. I think it's been quite successful.
Our next question is for Dr. Moeller. Just a few weeks ago, you were here to explain some of the new variants of COVID-19 that have been showing up in Columbus. Have there been any new developments since then?
Yeah, thanks for the question. I think a really important question that we're seeing on the news twice or three times a day. In one simple statement, it's important that we don't overreact, or we don't read too much into this until we get data. As we've seen, and as you know well, Dr. Allen, viruses in the past, and no different for COVID-19, viruses mutate. And specifically when viruses reproduce or what we call replicate, that they often create a mistake or a typo in their DNA. In science, we call this typo a gene variant or a mutation. And when these typos or variants become and make the strain more evolutionary competitive, for example, becoming more infectious, they often might become the dominant strain. Over the past 2 months, we've seen really two major developments related to the variation. First, the speed of this variation has sped up. Over the first maybe 7 or 8 months of the pandemic, it was a very slow evolution of this mutagenesis. Since November or December, we've really seen this speed up. And so number one, we've seen the rate of the mutagenesis speed up. Second, we're starting to witness what you, Dr. Allen, brought up a couple weeks ago, which is what we call convergent evolution, meaning that we're starting to see the virus create mutations or these typos in their DNA where they're trying to become more evolutionarily selective or advantageous. And this is similar to how different species, things like birds or mosquitoes, have evolved wings to be able to fly. And so in this case, we might see a strain in the UK or the strain in South Africa, or even strains in Columbus spontaneously or independently mutate to make themselves either more infectious, meaning the ability of a viral particle to stick onto a cell in your nose, or make the virus easier to replicate or reproduce. And so why is it important that we understand it? It's important that we understand it because in some of these cases, we're seeing rates of infectivity that might be 50% or greater when we have a specific mutation or a specific strain backbone. And that's important for understanding how we treat the disease. I'd say secondly, and Dr. Colburn can comment on this in a second, is that we also want to understand, do we need to recreate some of the tests that we use for diagnostics? Are we still having effectivity for our tests? Are we seeing any changes in the way that our therapeutics work? So whether it's convalescent serum or monoclonal antibodies or our vaccine, do we see any stress in that area? And third, might we have any impact of these variants on patient care or patient safety? So again, we want to keep our eye on these, but it's important as you see these news reports every night that we don't overreact and we make sure we get data until we take next steps.
Question for Dr. Colburn. Does the presence of these new variants change how we approach the disease when we're caring for patients?
At this point, no, we still approach patients with COVID the same way. So the key is diagnosing, so utilizing our testing, isolating, and for hospitalized patients, making sure to see if they're a candidate for any of our treatments, such as supportive care of oxygen or any therapeutic medications.
Do these variants cause more severe disease, or are they deadlier? Is one worse to get than another?
So there's a lot of research and close scrutiny going on about this. I think I would really emphasize what Dr. Moeller said. We need to really make sure we are having high quality data and not overreacting to initial reports. This is why the whole science community is coming together to have the best data possible. In terms of increased transmissibility, this is really our opportunity to double down on our tried and true infection prevention strategies, which is wearing a mask properly whenever you're out of your home, avoiding touching your face, washing your hands, and really maintaining physical distancing as much as possible.
Are the symptoms different from one variant to another?
As far as I know, I've not read anything where symptoms are different, but keep in mind that the range of COVID symptoms is broad, and so you really want to have a low threshold to, reach out to your healthcare physician or seek testing if you have any new symptoms that could be consistent with COVID.
Well, this question is either for you or Dr. Moeller. What makes one variant more contagious than another?
Sure. So I can maybe start with that, Dr. Allen. So when we think about these proteins, we almost see them in diagrams as being these long sticks, but in fact they're not sticks. They form really three-dimensional structures that look a lot like the cord that connects your telephone to your telephone receiver, and really create a structure. We've seen mutations on this sort of telephone cord make it so it bends the structure of the telephone cord and actually makes it so the spike protein on the virus can literally more effectively bind to the receptor on the surface of your cell. So we have very good data now across the world that specific mutations in the COVID-2 virus really impact this really stickiness of the virus to get into your body.
Does this affect the ability of our currently available COVID tests to pick up these new variants?
So I can comment on that one as well, unless Dr. Colburn. But so far we have the way that we designed our viral tests. We do it with multiple probes or multiple targets that we look at. So while some of the viral strains that we have seen may deflect or impact one of the probe sets, That's why we use 3 or 4 in a lot of cases. And so we have very good detection methods in place to look at these.
Are the vaccines effective against the viruses? Or the new variants of the virus?
Sure. So there are a lot of speculation out there today. And in fact, if you look at 6 different websites, you're probably going to see 6 different answers. Lots of incomplete data sets. But the short answer is that I have not seen significant data out there to suggest that the new variants significantly impact the effectiveness of the vaccine. I think it's important, Dr. Allen and Dr. Colburn or Dr. Thomas can comment as well, is that when we think about the way these vaccines were designed against massive parts of the proteins, massive parts of the virus, that we're looking at single or double or triple mutations on a backbone of maybe 12 or 1300. Furthermore, when our body has evolved this incredible immune response, it releases this massive, almost rainbow-like immune response that is massive and it's exceptional. And so what we may see over time is that we see a fractional decrease in the effectiveness of viruses, meaning that, or the effectiveness of vaccines, meaning that it goes from incredibly exceptional to maybe just awesome, but we still have effectiveness of our immune response to deal with these new variants. I would say one other thing, Dr. Allen, is that as scientists, we're constantly working to evolve our therapeutics. And so work that's being done in labs all over the world today is working on how can we recreate or redesign our vaccines to deal with these new variants. And I know that a lot of the major vaccine manufacturers are already work in progress to make sure that we stay ahead of the curve.
One final question for Dr. Colburn before we go to our media representative questions. The mRNA vaccines that we're currently using for COVID are different from the killed virus vaccines that we've been using for years for influenza and other diseases. Are these mRNA vaccines safe?
Yes. So I always like to point out when I talk about this that the mRNA vaccines have actually been studied for decades, since the 1990s. And researchers have been looking into how do we use this mRNA or blueprint to get the body to create this protein, which then can stimulate an immune response. And some major breakthroughs have happened really in the 2000s and 2010 decade, which is allowing the mRNA to enter the cell because our body will eat it up very, very quickly. And that's been a big roadblock. And so we were really fortuitous that these research advancements happened. And actually, several drug companies had completed phase 1 trials of mRNA vaccine against influenza, against Zika, before COVID hit. So they were able to quickly pivot, insert the genome of COVID, which was identified in January of 2020, so very early on, and then get these vaccines into trials and simultaneously start the manufacturing process so we could hit the ground running. This is unprecedented. I have never seen this kind of coordination before, and I think it has really benefited us tremendously.
Dr. Thomas, yesterday the governor challenged the medical community to improve vaccinations in minority populations. What is OSU and the Columbus community doing to improve disparities in vaccinations?
Jim, thanks for the question. We've had a significant focus on this issue, both internally for our own employees as well as externally in the community. We have, through our COVID Command Center, a number of different working groups. One of those is focused on internal education around the vaccine, and the other is focused on working with community leaders. And that could be anyone from certainly our public health colleagues at both Columbus and Franklin County Public Health. The county commissioners, we've been working with the mayor's office. They have a department that focuses specifically on neighborhood initiatives. We've also participated in meetings with, for example, African-American clergy, trying to find the best way that we can help them message into their communities so that we're not showing up with a message that's geared towards what we think is important, but really listening to the community, say, what are you hearing about concerns about vaccine hesitancy in your community that might be unique to your neighborhood, unique to your group of the population, to help really try to dispel fears and spread the truth around the safety of these vaccines, and just as Dr. Moeller and Dr. Colburn have been describing how they were developed and a little more on that reality. We also been working with the corporate community. We think that a sound strategy to get out to employees of corporations is to have effective messaging through people they work with every day. And last but not least, we've been doing large town halls within the medical center, trying to make sure that our own employees, as I mentioned, are up to date so that they can spread in their church, in their child's school, with their friends in their community, the importance of the real facts around how these vaccines work and how safe they are.
A question for Dr. Moeller and perhaps for Dr. Colburn. There was some new information released earlier today about the AstraZeneca vaccine and its effect on spread. Can you update us about some of that new information and tell us why that's important? And it seems like in the past, the focus of the vaccines has been to reduce infections, but this is a different spin on the efficacy of vaccines.
I'm happy to start out. So this is data that we have, I think in the community, been very excited to hear. So the trials of Pfizer and Moderna, for example, really the endpoint was symptomatic disease, which is a really important marker as well as severe disease, and had excellent efficacy. And we've been waiting on data about asymptomatic transmission. Basically, I don't feel sick, but I could potentially spread it to others. And that's another really key part that we need to know to inform our future strategies. So I'm cautiously optimistic about that report, but again, we need to have more data come in to really evaluate before we make any changes to our infection prevention strategies. Peter, do you want to add anything?
Yeah, I would just add that I think we're still in early days, and we need big data sets, and we need to make sure that these data sets really represent the population. And so again, just as we don't want to overinterpret negative data, we also don't want to get too excited about positive data until we see additional points.
Dr. Thomas, how is the vaccine supply going, and how is Ohio State balancing the supply with the state's rollout of age groups who are eligible?
Thanks, Jim, for that question. I think as I get this question from colleagues at work, colleagues at the university, my own patients, friends, neighbors, et cetera, family, I think one of the key messages is really around the number of manufacturers that are approved under the FDA EUA process. So that as we move forward over the next month, I think people are hopeful that we'll see one or two or maybe even more new vaccine manufacturers come online. Right now, the supply chain is not where we'd like it to be, but that's not an issue that the state has any control over. Obviously, the federal government can only ship us the amount of vaccine that they can ship us. So I think right now in the 1B populations, we have three groups. We have the group of elderly over age 65, and the state has taken an incremental approach to when those individuals can be invited to be vaccinated. This week, it's individuals 70 to 74. Next week, obviously, it's a quite large group of individuals 65 to 69. There are more individuals in each of those groups than we're getting total as a state in vaccine per week. So this is going to be something that even just to get through the patients over age 65 in 1B is going to be a period of multiple weeks and really moving into multiple months, potentially, to get everyone in those groups who wants to be vaccinated. The two other groups in 1B that have kicked off here in the last week or two, first are individuals that have a severe congenital, oftentimes neurological disability, and one of a number of different high-risk medical conditions. And that will change in about 2 weeks. That moves to individuals who have either a severe disability or a severe medical condition. That will also, once again, expand the number of people the week of February 15th who can get vaccinated. And then the other new initiative this week that started is K through 12 teachers. Really the focus there is on getting students back in the classroom, and having K through 12 teachers being vaccinated has allowed really the vast majority of school districts in the state, I believe nearly all, to agree to commit to be back into the classroom with hybrid or full in-class learning. When you think about where we were March a year ago when initially schools were closed in the state, some of our larger metropolitan districts have really not gone back to in-person education until this spring. So it's been nearly a year that these students have not been in the classroom. So I think it's, when you think about either it's a harm reduction approach looking at mortality for those at highest risk of severe disease and highest risk of death, and harm reduction in terms of those K through 12 students, either from their certainly their academic perspective, but from their physical health, their emotional health, their psychological health. Really, it's a harm reduction approach of trying to take what limited supply we have to those groups that the state can help the most to reduce harm.
Dr. Colburn, every year at influenza season, there are a dozen or more manufacturers of the influenza vaccine, and most medical clinics will buy their supply from one manufacturer or another. Now that we have two, and hopefully in the near future, three and maybe even four manufacturers of the COVID vaccine, should patients be concerned about getting the vaccine from one manufacturer versus another?
I think at this point, vaccine is important. In terms of the currently available mRNA vaccines, both from Pfizer and Moderna, are essentially identical in efficacy and safety. We need to wait for the final data for the other two, but what we are seeing is they all have excellent efficacies for vaccine. And so I think the key is shots in arms as fast as we can get it in.
Yeah, what I would add to that, Nora, is I think, most folks in the general population have not really focused on percent efficacy of vaccines ever. I think, when you look at the average year for the flu vaccine, and Jim, you're a pulmonologist, you know this data even better than I do. If we had a year where the flu vaccine was effective in 70-75% of cases, we would be jumping for joy as healthcare providers. There's been some years where it's been down in the 50s. I think we've all been lulled into this sense of security that every vaccine is 95% effective, as these first two mRNA vaccines have shown themselves to be. And that may not be the case. It does not mean the other vaccines aren't effective by any means. There's still actually some, I would say, best-in-class performance of the preliminary data we've seen of what we would expect from vaccines.
Andy, just to add to that, I think if we had a call like this last year at this same time, if we could, beyond our wildest wishes, to be able to say we had one vaccine that worked at least 50%, we would all be over the moon. So to be able to have potentially four that are above 90 or significantly above 50 is really spectacular, and an exciting year. Obviously, a ways to go, but a lot of good scientific advances this last year.
I think the other differentiator with these vaccines too that's important, Jim, to remember is they all have different storage requirements. So when you think about, we're planning to be at the Schottenstein Center. We planned out through the end of April. At some point, if there are additional manufacturers that have vaccine on the market, and those have a much simpler, for lack of a better word, storage requirements, that's the point in time when you're going to start to see this be more like the flu shot, where you can get it at your local primary care office. Because frankly, most primary care offices don't have the type of storage equipment that you would need for example, the Pfizer vaccine. So I think that's the other benefit in terms of right now, there are over 90 locations in Franklin County where you can get the COVID vaccine, and over 1,000 in the state. There were over 2,000 locations that have applied to be administration sites in the state. As supply increases, more of those will come online, but also a variety of locations can come online because of these differences in storage requirements, and really trying to get that last mile of getting the vaccine to the patient's arm just gets easier as these storage requirements change.
The only thing I do want to add is, we know this from influenza vaccination, which even a good year for influenza is a 50% efficacy, believe it or not. But the key is, if we can get widespread immunization, we can actually decrease that community viral load, the amount of virus that is circulating, and it's almost like a symbiotic result, is that if the more people are vaccinated, the better it overall works. So that's why it's really important that we stress how to have everybody get vaccinated when it is available to them.
Well, I have one final question before we close out to this morning. This is to Dr. Colburn. We've been hearing about double masking. What's your take on double masking?
So that is being looked at by the CDC, which is great because we always want good data to drive our decisions and to drive our interventions. I think at this point, we really need to make sure that everybody is wearing a good quality mask. So from the beginning, the CDC has always recommended that you have a mask that's at least 2-ply. It needs to be well fitted over your face. It has to cover your nose and your mouth without gaps on the side. And it needs to be worn anytime you are outside of your home and you might be around other people. That also includes outdoors. So when you're walking from your parking garage to your office or to the grocery store, you should have your mask on. You shouldn't touch your mask as much as possible. So we contaminate our hands with viruses, germs from whenever we touch things. And if we touch our mask, we can contaminate it. So when you remove your mask, remove it from the ear loops and then wash your hands. That's a great opportunity to wash your hands too. So really focusing on good mask technique and also the other tools in our toolbox: hand washing, staying home when you're sick, physically distancing. These are the keys to stopping COVID transmission.
Well, let me thank today's panelists, Dr. Andrew Thomas, Dr. Peter Moeller, Dr. Nora Colburn, and let me thank each of you from the local media for the role that you're playing to keep the people of Ohio up to date on the COVID-19 pandemic. We'll be back next week to talk more about the latest news on COVID-19. And until then, encourage everybody to wear a mask, practice hand hygiene, and promote vaccinations.